What if the gentle creak in your knee or the morning stiffness in your hands is more than just a sign of getting older? What if it's a silent signal that your body is sending you, a plea for help that most of us simply ignore until it becomes a roar of constant pain? This is a reality for millions, but it does not have to be your reality. Welcome, my friends. Professor Vitalis here with your daily dose of wisdom and wellness, where science and experience walk hand in hand. Today, we embark on a crucial journey into the inner world of our joints. We will unravel the mystery of why some people seem to glide through life with an youthful ease, while others are plagued by painful, creaking joints that dictate the rhythm of their days. We are going to explore natural, science-backed ways to not just manage, but to truly reclaim your joint health without relying on a cabinet full of harsh medications. Can certain oils truly soothe an aching joint? Does bone broth actually restore cartilage, or is it merely folklore? We will look at the science, and most importantly, we will learn how to listen to our body's earliest warning signs, long before the pain becomes a constant companion. And I urge you to stay with me until the very end, because I will share a profound insight from a seasoned orthopedic specialist with over 3 decades of experience. A secret that shifts the entire focus of treatment away from the joint itself to something most people completely overlook. This one piece of information could redefine how you approach your joint health forever. Let's begin by understanding what is happening within our bodies. What have your teeth and your joints in common? Both can suffer from wear and cause significant discomfort, but here's the beautiful difference. Unlike a tooth, your joints possess a remarkable innate ability to regenerate. This natural process of rebuilding bone and cartilage tissue is constantly at work, responding to inflammation, injury, and even the simple effects of aging. So, the key question isn't whether your body can heal, but why this process sometimes fails. As we age, a few things change. The joints are cushioned by a remarkable substance called synovial fluid, which also lubricates them for smooth movement. Think of it as the high-performance oil in your body's engine. With time, this fluid can become thicker, more viscous, and less effective. At the same time, the cartilage, that smooth, pearly white cap on the end of our bones, can begin to thin out. Imagine cartilage as a plump, juicy grape. Over the years, it can lose its water content, becoming more like a raisin, thinner, less resilient. Now, it's important to know that the cartilage itself has no nerve endings. It can't feel pain. But the bone beneath it is rich with nerve endings and sensory receptors. When inflammation sets in, it can irritate these nerves, causing the deep, persistent discomfort so many experience. The source of this pain can be varied, from vitamin deficiencies to conditions like gout or simple mechanical wear and tear. But for most, it stems from this slow degeneration. Understanding the nature of your pain is the first step toward finding relief. Think of it this way. Pain when you're resting, perhaps a throbbing ache as you try to sleep, is often the body's fire alarm. It signals active inflammation. Pain that spikes when you move, on the other hand, is more akin to a mechanical issue, a sign of wear and tear, or what we call arthritis. The common experience of morning stiffness, which gradually fades as you begin your day, is a classic sign of inflammation that improves with gentle movement. Some people reach for strong painkillers for immediate relief, and while there's a place for that, it is a short-term fix for a long-term problem. A much more effective approach is to address the root cause, to free up compressed joints, to engage in targeted anti-inflammatory exercises, and to nourish our bodies with anti-inflammatory foods. Simple lifestyle changes can have a profound impact. If you are carrying excess weight, every pound puts about 4 pounds of extra pressure on your knees with every step. Losing just 10 pounds can feel like taking a 40-pound backpack off your joints. If your hands ache, be mindful of lifting heavy objects. If your hips or knees are the issue, avoid sudden jarring movements and invest in well-cushioned shoes. Activities like swimming are a gift to sore joints, as the water supports your body, allowing for pain-free movement. However, the most common mistake I see is people avoiding movement altogether out of fear of pain. This is a profound error. Movement is life for your joints. Your cartilage has no direct blood supply. It gets its nutrients from the surrounding synovial fluid. And how does that fluid circulate? Only through movement. Gentle, consistent activity acts like a biological pump, pushing nutrient-rich fluid into the cartilage and flushing out metabolic waste products. Inactivity literally starves your joints. Furthermore, strengthening the muscles around the joint provides a natural brace, reducing pressure and increasing stability and mobility. Before the pain becomes chronic, your body sends out warning signals. Let's learn to listen. The first is that morning stiffness we discussed, that feeling as if your joints have turned to stone overnight. If you feel a burning sensation, especially if the joint is also red and hot to the touch, this points directly to active inflammation. If you feel the burn without the redness or heat, it may be a sign of osteoarthritis. Another signal is limited movement. Do you find it difficult to fully bend your knee, to grasp a small key, or to lift your leg up a high step? Your body is telling you something. And what about those creaking, cracking noises? Sometimes this can happen when the joint fluid is low, causing the surfaces to rub. But often, in a healthy joint, these sounds are harmless, just pressure changes or tiny gas bubbles popping in the fluid. If there is no pain and your range of motion is good, it's usually nothing to worry about. Many of you also tell me you can predict the rain better than the weather forecast with an ache in your joints. This phenomenon, weather sensitivity, is very real. We believe it's linked to changes in barometric pressure, which can cause the body's tissues to expand and contract ever so slightly, irritating already sensitive nerves. In winter, the body cleverly reduces blood flow to the extremities to keep your core organs warm. This can lead to more discomfort in hands and knees. The simple solution is to keep your joints warm. If you notice any of these signs consistently, it is wise to consult a specialist. Now, let's talk about building healthier joints from the inside out. Your diet is your pharmacy. Fatty fish like salmon, sardines, and mackerel are rich in omega-3 fatty acids. Think of these as your internal fire department, helping to quell inflammation and preserve the flexibility of your cartilage. But they aren't the only source. Walnuts, flax seeds, and almonds are also wonderful additions. Combine these with antioxidant-rich foods like blueberries, pomegranates, and red peppers, which further help to reduce inflammation. Protein is non-negotiable. It provides the literal building blocks for tissue repair, whether from meat, fish, eggs, or plant sources like beans and peas. And we cannot forget collagen. It is the very scaffolding of your body, found in tendons, ligaments, and cartilage, providing shock absorption and reducing friction. As we age, our natural collagen production declines. Consuming collagen-rich foods like bone broth, gelatin, or certain meats can provide your body with the raw materials to help maintain this crucial framework. And for an extra anti-inflammatory boost, incorporate spices like turmeric and ginger into your daily meals. While the regeneration of cartilage slows with age, it never stops completely. A simple, accessible, and affordable remedy is gelatin. It is a pure protein that helps strengthen cartilage and connective tissue. Here's a simple method. In the evening, mix 2 teaspoons of plain gelatin into 1/3 of a glass of cool filtered water and let it sit overnight. In the morning, top the glass with warm water, stir, and drink it on an empty stomach. Practice this daily for a week, then take a month's break. This provides a direct, inexpensive source of collagen for your joints. You can also try a homemade compress of aloe vera and honey to soothe pain. Mix equal parts aloe vera juice, honey, and warm water. Apply it to the sore area, cover it with plastic wrap, and leave it on overnight. Another traditional remedy is pepper oil. The capsaicin in red peppers creates a warming sensation that can override pain signals, and it stimulates circulation. To make it, finely chop 10 fresh red peppers, place them in a jar with 2 cups of vegetable oil, and let it steep in a warm place for a week. You can then use this oil to gently massage sore joints, but never use it if you have a fever or on broken skin. A simple mixture of a 1/4 cup of honey and a 1/4 cup of apple cider vinegar can also be beneficial. Just take 1 teaspoon morning and night, and never underestimate the power of a warm bath with sea salt to relax muscles and reduce inflammation. Now, for the insight I promised you. A respected orthopedic surgeon with over 3 decades of healing patients shared this with me. He explained that we often focus our entire attention on the joint, the bone, the cartilage, when we feel pain. But the real culprit, the true jailer of the joint, is often the surrounding muscle. He described it as a muscle cage. Over time, from stress, injury, or poor posture, our muscles develop tight, painful knots known as trigger points. These knots can pull constantly on the joint, compressing it, restricting its movement, and referring pain that we think is coming from the joint itself. For instance, chronic tension deep in your gluteal muscles can manifest as debilitating knee pain. The secret, he explained, is not just to treat the joint, but to release the cage, to work on the muscles, to release those trigger points, and to give the joint the freedom it needs to function and heal properly. This is a paradigm shift. It means that even at 62, it is entirely possible to be more flexible and have less pain than you did at 30. The key is to remove these muscular blockages, maintain a healthy diet, and stay well hydrated. The true issue is often not age, but the quality of our connective tissues. Your joints are fundamental to living a full, active life. By following these simple principles, you can enjoy pain-free movement for many, many years to come. Knowledge only works when you apply it. I'm Professor Vitalis. Stay curious, stay healthy, and never stop learning.